Hi, we are the CurleyQs, and we did our vulnerable population presentation on middle-aged African American men living on Skid Row. Skid Row is the greatest man-made human disaster in the United States, and it's been here for longer than 127 years. Right now, it is the worst it has ever been. It is a crisis of epic proportions. This is a quote by Reverend Andy Bales, who is the CEO of the Union Rescue Mission, which happens to be the largest rescue mission in Los Angeles. As previously stated, the population that we chose for our presentation is directed towards the middle-aged men that are homeless living on Skid Row. And to describe this vulnerable population, we can say that these horrifying streets are home to the unwanted. As of recently, many police officers from other jurisdictions have been seen dumping homeless people in this area. They cannot provide correct services to them, so they dump them there. Already overwhelmed with the abundance of homeless people, the county is facing a major problem with social service organizations being short-staffed and are experiencing a shortage of funds. Any services that homeless persons might be offered is located in the downtown area of Los Angeles. People that end up on the streets here at Skid Row is usually due to family breakups, domestic abuse, drug addiction, mental health issues, and/or prolonged unemployment. Estimates of Skid Row's population range from 8,000 to 11,000 people. It is predominantly Black male population, although over recent years the number of women and children has increased as well. About 20% of the population is veterans, and many suffer from substance abuse and/or mental health issues. There are approximately 6,000 permanent residents in hotels and approximately 2,500 homeless individuals, with actual numbers varying by season and by time of month. Approximately 2,000 to 2,500 persons make use of the shelters, mission beds, and transitional housings in certain areas with available resources. Numerous individuals on extremely low fixed incomes may alternate among hotel rooms, shelters, and the street over the course of the month. The Union Rescue Mission, which was developed in parallel to Skid Row, can trace its origins to the late 19th century, when the area east of the Tony Bunker Hill became the domain of brothels and saloons. By 1876, Los Angeles was the final stop on the Transcontinental Railroad, leading to an early population boom fueled by land speculation. Followed by the Great Depression of the 1930s, LA's Skid Row saw an infusion of men from the rest of the United States heading west in hopes of earning a living. Often, they wound up on Skid Row, where they could find housing, food, or shelter of some kind. The pattern of this transient population continued into and past the Great Depression, well into the 1950s and 1960s. But the 1970s saw a dramatic and profound change. Where once the population had been dominated mostly by men who suffered from alcoholism, the 70s brought Vietnam veterans and heavy drug users down to Skid Row. In addition, legislation was passed to deinstitutionalize hospitals serving individuals with severe mental illness. This was carried out by the Reagan administration in the early 1980s. Public health advises and works closely with government agencies and community partners to address health and safety concerns facing people experiencing homelessness, specifically down in Skid Row. The 2017 hepatitis A outbreak and the countywide increase in flea-borne typhus cases in recent years highlights the need for collective action to address sanitation issues, rodent and wildlife infestations, and illegal trash dumping. Public health continues to collaborate with cities to migrate unsanitary conditions, to minimize public health risks that arise from illegal trash dumping by businesses, rodent infestations, and lack of adequate facilities for personal hygiene and sanitation at the homeless encampments. Public health's efforts are also grounded in partnership with the county departments and community organizations to connect people experiencing homelessness with needed services and supports, including interim housing, health services, and economic stability. Los Angeles, California ranks in as the second largest city in the United States. And of the estimated 91,000 homeless people living in the Los Angeles County, it is estimated that 2,521 homeless people can be found within the 0.4 square mile radius that is known as Skid Row. Those numbers equate to roughly 3% of the county's entire homeless population residing within an area that comprises only 1/1000th of the county's total land area. This 50-block section of downtown LA holds the largest concentrated area of homeless people in the entire United States. The section of 5th Street is also referred to as the Nickel, and it has been said that Skid Row is America's only third world city.
A piece of history. The area of Skid Row covers 4.3 miles and 50 blocks in Los Angeles, which is a rather small area when considering LA's size, but this area makes up 8% of the entire homeless population of Los Angeles. When understanding the definition of homelessness, we must know the difference between sheltered versus unsheltered. Those that are considered sheltered are without a permanent place to live, but they do have a regular place to stay, such as a homeless or women's shelter. Being unsheltered means that the individual lives in a car, tent, or on the street. An astonishing 75% of the homeless population in all of Los Angeles are considered to fall under the unsheltered category, and an even higher percent on Skid Row. A key part of this has to do with the lack of regulations on shelter for the homeless. For example, New York City only has 5% of the homeless population unsheltered because their courts have determined that the city must provide shelter beds for all, unlike in Los Angeles. There is many overlapping reasons why people become homeless, but chronic homelessness only comprises 27% of Los Angeles County's entire homeless population, meaning the solid majority of people who become homeless will not just eventually get out of this situation, but they will not return to it. Out of the many men that live on Skid Row, 75% of them were residents to Los Angeles prior to becoming homeless. 65% of these men lived in LA for over 20 years, while only 10% were in LA for less than a year. African American middle-aged men are at an extreme disadvantage when trying to break the cycle of homelessness. Dion Joseph, an LAPD senior lead officer who patrols Skid Row in Los Angeles, said, "Being African American and growing up in the 80s, I saw how this disproportionate problem of crack cocaine devastated communities of color. Some people could go get treatment in Malibu, but black and brown people ended up in prison, and we still see the effects today. Historically, this population is not offered the same chance or benefits that other races or age groups may have. The age of this population plays a very big role in the help that they may receive. Although this group is also underprivileged, they are not considered as helpless and or hopeless as women, children, and the elderly often are, so they are much less prone to receive assistance." The African American middle-aged man is exposed to many psychosocial concerns while homeless. They have to face problems that they may have developed prior to becoming homeless, such as substance abuse, family problems, and anxiety. The population also has to deal with problems that they will experience during and after homelessness, such as stress, depression, homelessness, and anger. These problems may go untreated due to lack of understanding of the situation, environmental and situational triggers, and the lack of a support system. For the majority of this population, they are homeless because LA as a whole is becoming less affordable. Los Angeles has the highest poverty rate in the entire state, meaning that there is an elevation in people who are considered low economic status and not enough resources to fix this problem. Many people resort to things such as stealing, bargaining, or panhandling to support themselves. Due to the high and growing volume of Los Angeles County citizens, it is no surprise that there are many more people than housing. With the growth of the county, it allows for more competitive pricing on housing, and people, especially the homeless, simply cannot afford it. The middle-aged African American man is at more of a disadvantage because many of the housing services provided cater to women and children. Among many barriers that this population may face, finding a job may be one of the most challenging. To the average employer, the reason is simple. Do they take a chance on hiring a homeless, middle-aged African American man, or do they hire one of the many other applicants that do not have such a challenged past. With the overpopulation of the county, there are qualified people everywhere, and with barriers such as lack of schooling, experience, transportation, stability, etc., it makes it very hard for a member of this population to land a job. With the lack of education and high dropout rates of many homeless men, it heavily affects their ability to earn sufficient incomes in order to support their needs.
There are a few specific health concerns that this vulnerable population has experienced and is still experiencing. Drug abuse has been the biggest concern. While we were doing our windshield survey, we noticed discarded needles on the ground that were probably used for illegal drug use, such as heroin. We also encountered firefighters responding to an anonymous call who reported someone overdosing on an illegal substance. Illegal trash disposal is another concern because this results in a lack of cleanliness on the streets, which causes the rodent and typhus infestations. Typhus is a vector-borne disease that gets into a person's bloodstream through fleas, ticks, or lice. It doesn't transfer from person to person like a flu, but it could be an epidemic due to unsanitary conditions in Skid Row. Risk factors include living in areas where rats or other animals have high populations, such as the previously mentioned homeless community. Sanitation is another major concern of this population due to the lack of resources in Skid Row, such as clean public restrooms, so they end up defecating and urinating on the streets. Another problem is access to clean drinking water. So on the next slide, you'll see a short video of a middle-aged man drinking water directly from a fire hydrant, which we all know is unfiltered and could be carrying diseases that we don't know about.
Are there these conditions emergency shelters? Oh, no. It could be.
For the prevention and control of health concerns that were mentioned previously, some examples of primary prevention are assessing the community's needs and also educating the community regarding the health issues caused by drug abuse and poor sanitation. Establishing adequate toilet facilities and associated hand washing stations provisioned with soap, water, and paper towels would also be beneficial, in addition to teaching the community proper hand hygiene techniques. For secondary prevention of drug abuse, we should assess for signs of drug addiction and drug abuse within the community so intervention can be done to address the issue. And regarding poor sanitation, a plan for timely identification and subsequent cleaning and disinfection of the accumulated feces, urine, and other waste should be established to prevent the risk of typhus infestations from rodents and other illnesses. Lastly, for tertiary prevention, information and referral to rehabilitation programs and other resources should be provided to those who are going through addiction and drug abuse. And to address the sanitation concerns, adequate waste receptacles and routine garbage collection services should be provided to be able to maintain a cleaner, more sanitary environment. This will also ensure that waste does not accumulate on the ground surfaces at and around encampments, which are often used as cover for illegal waste dumping by businesses.
Homeless people are less likely to access traditional health care due to barriers such as geographic location, demanding of health needs, poor health literacy, language, education, cultural, and financial hardship. Public health nurses advocate for populations who do not or cannot support for themselves. Activities with vulnerable populations include case management, advocacy, policy development, and enforcement. Being cultural competent enables effective practice with diverse individuals, families, and groups within the community of care. Core functions of public health consist of assessment, policy development, and assurance. Assessment monitors health status to identify and solve community health problems. It identifies health risks such as HIV, AIDS, alcohol, drug abuse, mental illness, tuberculosis, hepatitis A, B, and C, and poor nutrition and hygiene. Policy development informs, educate, and empower people about health issues. It develops policies and plans that support individual and community health efforts. For example, medical respite programs provide hospitals with an alternative to discharging homeless patients to the streets or to unequipped shelters when patients would otherwise be discharged to their homes for self-care and recuperation. Medical respite is short-term residential care that allows individuals experiencing homelessness the opportunity to rest in a safe environment while accessing medical care and other supportive services. Lastly, assurance evaluates effectiveness, accessibility, and quality of personal and population-based health services. It focuses on the availability of necessary health service throughout the community. It also ensures the provision of a competent public and personal health care workforce. Union Rescue Mission is one of many facilities that help with homelessness. It offers more than just meals and shelter. They provide free clinics for health care, dental care, psychological counseling, legal guidance, and learning centers that features computers and instructors to provide education, vocational skills, and trade support. One of the greatest needs among people experiencing homelessness is education. Lack of education is a significant barrier to independence, but it's a barrier we can help them overcome through instruction, inspiration, and motivation. They also provide additional vocational education and trade support, such as janitorial services, certification through programs offered from various community partners. John Wesley Community Health Institute is a nonprofit health agency that walks the streets, alleys, and under freeways of Skid Row and conducts health assessments, offers resources for substance abuse and incentives for treatment, referrals for placement into transitional permanent housing, and assistance in reuniting with family and other support networks. The Midnight Mission Shelter provides a 12-step recovery development program to offer a compassionate bridge to help homeless individuals achieve and maintain healthy, productive lives. They remove obstacles and provide the accountability and structure that people who are experiencing homelessness need to be productive in their communities.
Although there are missions, shelters, and other programs available to assist our vulnerable population, there are still additional resources that this community needs. An example would be a place that can offer job training so they can gain skills, and they also need job opportunities to help them get out of poverty and homelessness. They also need a source of electricity, especially at night when it gets dark, and during cold seasons to keep them warm.
In this presentation, we talked about the history of Skid Row and discussed the issues that our chosen vulnerable population is experiencing. We also provided specific health concerns and what interventions a public health nurse can do to help. We also mentioned the available resources that they currently have in their community and determine other resources that the community needs.